Good evening, everyone, and thanks for joining us for this University of London event for students who live in our intercollegiate halls. My name's Adrian Clark, and I'm the Student Health and Wellbeing Manager, as well as being the warden at Connaught Hall. And we're joined tonight by two doctors. I think you've heard us chatting while we were waiting for everyone to join, from two doctors from Gower Street Practice to explain how to register with an NHS doctor in London, how to access the services available, and to talk about the range of services specifically on offer at Gower Street Practice. And of course, here at the university, we really strongly recommend that you register with a GP as soon as you can when you arrive in London. It's the best way to ensure that you're able to access medical care quickly and conveniently if you need to. And of course, Gower Street Practice is very well located for many of our halls in Bloomsbury. I'm not going to take up any more time this evening, so in just a moment I will introduce our guest speakers, but throughout this evening's event, please feel free to drop any questions into the Q&A section of Teams. We'll either be able to answer them in chat as we go, or we'll find some time at the end to answer all your questions. And so now I would like to introduce Dr. Baawuah and Dr. Harland from Gower Street Practice.
Thank you very much, Adrian. Can you see the slides?
Yeah, we can see them.
Excellent. Welcome everybody today. My name's Dr. Frances Baawuah, and I'm here with my colleague Dr. Jessica Harland. We're both GPs and we are partners at the Gower Street Practice, located very close to where you are, and for those who are international students, welcome, and we hope that you're settling in okay, and for those who are new to London, also welcome. As Adrian has outlined, we're going to just really be using this as an opportunity to explain to people and to students and young people how the health services work, because sometimes, well, not sometimes, now is a very big transition in many people's lives, and you've gone from often being under the roof of parents or guardians or carers to becoming a bit more independent and having to manage things that perhaps you weren't managing before on your own. So the next slide I just want to touch base on is really explaining to people how the NHS might work, because people may not be familiar with this. But what we really wanted to explain to people was that sometimes people are ill and they're not quite sure where to go and how to seek help. And so I've done here really a triangle of care, and the triangle really does focus on where kind of the proportion of help can be sought. So lots of times when you've got a scratch or a burn or a rash or something very minor, or even, you know, a runny nose, often you don't actually need treatment, and often these things are self-limiting, or you can do things on your own, or just go to a pharmacist. And if you go on your phone and you put on the Google, you know, local pharmacist, and attend there, they can often help you. If they're not able to help you, then the next level of care would be your GP, which is where myself and Dr. Harland and Gower Street Practice sit. So we do really deal with the most of your healthcare needs. And if we feel that you need further treatment, we would then do the next level, which is the hospital treatment, where we would be doing a referral. And we've put accident and emergency at the top because that's often for accidents and emergencies. So really urgent things that can't wait for a routine appointment, or can't wait a day or two for you to see your GP, or when you're very, very unwell and you may need to be admitted to hospital. And I think that's really important to stress that, you know, if things are not an emergency, or they're not an accident, or they're not life-threatening, going straight into accident and emergency in the UK NHS healthcare system probably isn't the best way to seek care. So really, if you were to register at Gower Street, and we can explain to you later on how you might do that, these are really the ways in which you can speak to healthcare professionals. So we've got telephone appointments, we've got online appointments where you can type in what's the matter with you and upload pictures of a rash, or of, you know, or of something you might want us to see. We do email consultations. You can book to see a face-to-face appointment if you feel that actually you would like to see a doctor. And we have a range of urgent and non-urgent appointments, which is why we split this this into routine appointments or same day appointments, depending, of course, on how urgent the problem is. So, you know, an example might be that you've got a medication and you're due to run out of this tablet in 7 days' time. We would give you a routine appointment with a week, as opposed to doing something on the same day, which might be a problem such as, you know, you've got a terrible asthma, your wheeze is worse, or you've run out of something like, you know, the contraceptive pill, or a medication that's very important to take, like an antidepressant medication, for example. That would be something that we would deem more urgent. But if often you're not sure, doing an online consultation would be the best way to find out, because then you get a quick response as to your level of need. I'll let Dr. Harland continue.
Hi, everybody. So we offer essentially the full range of GP services that you might expect. Contraception, mental health services, including access to therapies, both sort of short-term, long-term, face-to-face, online. There's lots of options if you come and see us about that. If you do find you're experiencing, I mean, I'm sure you're all going to have a wonderful time. It's going to be really exciting and positive, but it can be a difficult transition, and some people do find themselves struggling a bit. And so do come and talk to us about that, as well as talking to our university services, because we're very, very used to talking to students who are finding it's not quite what they expected. We can provide immunisations that you might need. We can talk to you about sexual health and tell you how to access more extensive testing. We deal with lots of chronic conditions like diabetes and asthma. When you hit 25, you will need to start having smear tests, and we'll do those for you. But really, we cover every medical complaint that there is. So we're always going to be your first port of call, and then we will send you on to any specialist that you might need. Next slide. So in our team, we've obviously met me and Francis. We're GPs. We've got several other GPs who work in the practice. We've also got a practice nurse. We now have a very wide range of types of people that work in the surgery, and these include physicians associates, therapists. We've got a psychiatrist that we liaise with very closely. So you might not always see a GP. We've got a lot of different options of clinicians for you to see. Can I have the next slide? I'm not sure how many people on the call are from overseas. I think when I was a student, I wouldn't have had any clue how healthcare was organised or accessed, let alone accessing healthcare in a foreign country. We've got lots of information on our web page, on our student information page on our website. But briefly, I thought I'd tell you a little bit about who's eligible. Obviously, UK citizens are eligible for all NHS treatment, but if you are not from the UK, it's more limited. Now, if you have paid the immigration health surcharge, then you will be entitled to normal NHS services. But there are a few things that everybody is entitled to. First of those is emergency care, so A&E. There are certain health conditions that you're also entitled to free care. Some infectious diseases like TB, some sexually transmitted infections. You may be interested to know that if you have paid the immigration surcharge and you have a baby, your baby is entitled to free healthcare. But as you're about to start your studies, that might not be the perfect time for you. So you'll be glad to know that family planning is also free for everybody, contraception of all kinds, and we can help you with that. If you're not entitled to the NHS healthcare, for example, if you're going to be in the country for less than 6 months or you haven't paid the surcharge, strongly recommend getting health insurance to cover any health problems that you might have. If you do end up needing NHS treatment and you're not entitled, you will be charged, I'm afraid, and it won't be cheap. And they do find you, they do follow you up, so do make sure you're prepared for that. But once you're if you are entitled to NHS treatment and you're registered with us as a GP, if you also have private insurance, that's fine. You can still come and see us, and often the insurance company will need some referral letters or something like that, and we can help you find the private specialist that you might need. Language support, if you're having difficulty with English and it's not your first language, we will obviously access a translator for you. So again, there's a lot of information on our website, but there's a few sort of must-dos when it comes to your health. Make sure you download the NHS app. It's incredibly, for an NHS provided thing, it actually works really well. It's easy to download, and you can see all your regular medications and you can order them. You can see your appointments that are coming up. It's really, really helpful. Obviously, we really, really want you to register with a GP, because even if you feel great and fine now, you don't know when you're not going to feel great and fine, and you need to have that set up so that you can easily get seen. Make sure you're up to date with your vital immunisations. So you should have had all your childhood vaccinations, we hope. If you haven't, we'll obviously help. Everyone up to the age of 25 is entitled to the meningitis ACWY. We do a big, you do get that when you're younger normally. Make sure you've had it. Tends to be a bit of a peak in meningitis as lots of young people mix with lots of other young people. It's quite a high risk period. So if you haven't had that, do let us know, and we'll definitely get that done for you quickly. Another piece of advice I'd give you is, if you're joining us for the first time and you've had some health issues to date, try to bring along as much information as you can to help with that handover period. Bring your latest clinic letter, bring your list of medications, because it's not automatic that any records that you've had in your old GP surgery will automatically transfer over. Often it does, but not always. So always best to have your own records as well. Next slide. So that's it. We don't want to take up too much of your time. I'm sure you've got much more fun things to think about right now. It's a really exciting time for you guys, and we wish you all the very best. If you scan this QR code, you can go straight to our registration page. It's very quick, it's online. I'm going to give bonus points to anyone who can tell me what QR stands for. Anyone want to put it in the chat?
Very good question.
Having said that, my dad told me this, so I might need to check his source. Are there any answers in the chat?
Fake news, do we, about QR codes? That's a very good question. Though I have no idea.
I think it's quick response.
Oh, there we go.
That's from my dad. So we'd love to meet you guys if you would like to come and join our practice. But for now, we're very happy to answer any questions you might have. Just pop them in the Q&A.
There's one question at the moment about dentists, and I've just tried to explain there that NHS doctors are very, very separate to dental care. So you would have to find a dentist in the same way that you're registering with a GP. And dental care is a bit more tricky to find, I have to say, because they often have long waiting lists. But if you go online and look for a local dentist, then that would be a separate service.
You can also go on the NHS website, nhs.uk, and that will help you find a dentist. You put your postcode in, it will tell you your closest options. I'm going to put the link to our website student pages on here as well, because it's a wealth of information.
Thank you, and I've put the link to find a dentist in the chat there as well.
How do I put something on?
If you go to the Q&A.
I have to make an announcement.
Yeah, no, that's the one. Yeah.
Oh, not working.
We have another question from another anonymous user. How long does one usually have to wait after an appointment?
Do they mean to make an appointment? Probably.
Yeah, I'm thinking how long how long from deciding you need to see a doctor does it take to see one, I guess, is
yeah, and so that's a very good question. And I think that we have different ways that people can access. It depends on really how urgent the appointment is. Sometimes things are very urgent and we will see you on the same day. If we get a quick, we kind of triage, and what that means is we try and understand from you what the problem is. And if we think it's an urgent appointment, we will see you on that day. If we think it's not urgent and it can wait, we really try and aim to see everybody within a week. But if it's urgent, we will definitely, and I think we're pretty good at knowing what's urgent and what's not urgent. We will see you that day, but otherwise within 7 days usually.
Just had a question there to put the link to register, and we have put that in the chat just now. We have is the IHS fee paid to the immigration office refundable if we have health insurance somewhere outside the UK, but it covers all fees?
I don't think that is refundable money. No, that's like a down deposit that just is there, I think, and you're not able to get that back. So I think that is a separate fee.
Is there a free HPV vaccine for people aged over 25?
Over 25, no.
Yeah, it's only eligible.
Pay that privately. But I know that there are several pharmacists on Gower Street that do it. Not Gower Street, sorry, Tottenham Court Road. That's a good question.
I guess the other vaccine at the moment to be thinking about is the flu vaccine, isn't it? That's being pushed in the news at the moment, which most people of student age who don't have other health conditions wouldn't be eligible for a free flu vaccine, but it's possible to get one, I think. Yeah, absolutely. Pharmacies will let you buy one. It's not expensive at all. I've had mine. It was nice this year. It didn't give me any side effects. In fact, I felt better the next day than I did the day before. And again, it's a good idea. The commonest thing we see in the first 6 weeks is fresh as flu. And honestly, people just get every new virus going around. The flu vaccine doesn't prevent every case of flu at all. But it does reduce your chances and hopefully make it a bit less severe if you do get it. So I would get it if you can. Do anything you can to keep yourself feeling fit. If you've got an underlying health condition, you'll be eligible for a COVID vaccination again as well.
Somebody's asked about making a routine appointment with a gynecologist. The way that the NHS works is that really you don't have access to specialists immediately. I know that in some countries, a gynecologist will do things like a cervical smear test, or it's only a gynecologist that can do certain things. The NHS is actually, it doesn't work like that. And often the GP is the first port of call. We do smear tests. We're able to do gynecological examinations as needed. And if we think you need specialist referral, we would then refer you onwards. But most of the time, my experience with young students is that often we can manage a lot of these gynecological issues within general practice before having to refer. So if you're worried about something, the answer to that really is just to register with a GP and discuss your problem with them, and they can help navigate that.
Been really good to have so many questions coming through. I guess we could pause for just a moment to see if there are any more questions coming through, maybe.
It's always interesting to see what people want to know about, actually.
I have a question about where to get a flu shot.
Where to get a flu shot? Any pharmacy. Loads of pharmacies do it. I think they probably charge about £10. You just walk in. You wouldn't need an appointment. But if you are entitled to one, obviously, if you've got something like asthma, for example, it's free, and we can do it. We'll be doing some flu clinics at our practice. Shall we leave it there, Adrian?
Yeah, I think we. It looks like we've reached the end of the questions, doesn't it?
Yeah, I think people are dropping off as well. So thank you everybody for attending, and do register with the GP, and maybe we'll see you at Gower Street. And thank you, Adrian, also for your time.
Thank you both for spending this evening with us. Thank you so much.
Take care, everybody. Bye-bye.
Bye, everyone.